Thank you.
I'll do your presentation for you.
All righty. Well, good morning, everyone. Good morning. Did you have a good exercise? Yes. Oh, good, great. My name is Linda Furlough, and I am the co-chair of the Nova Scotia chapter of Dying with Dignity Canada. Excuse me. As a chapter, we were very, very active a number of years ago prior to the legislation being changed at the federal level to allow for end-of-life options, one of them being MAID, medical assistance in dying. And so basically what I'm going to do today is I'm just going to talk a little bit about the chapter. During COVID, of course, like a lot of organizations, things just kind of shut down. And so the chapter kind of went into a sleep mode, I guess you could call it that. Some people resigned, other people moved to other areas, and unfortunately a few of the members actually died. And so about 2.5 years ago, Dying with Dignity Canada, the national office, excuse me, sent out a bunch of emails to people seeing if they'd be interested in reactivating the local chapter. And that's when I became involved. And what we have done in the last 2 years is that we have focused our energies, because we're still a small group of people, to making presentations about end-of-life options. And so in the last year, we've been able to get some volunteers from different parts of the province, because one of the things that I was determined that I wanted to see done was that it truly be a Nova Scotia chapter and not just a Halifax-based chapter of Dying with Dignity. And so we've been fortunate in getting some members from Cape Breton, from down the South Shore, and from the Eastern Shore as well. It's not done yet. I still would like to see more members join us from different parts of the province and in helping us making presentations and providing information for people to make informed decisions. And so, can we go to the next slide so I don't get myself lost here? One of the things in our presentation that we talk a fair bit about is what we call advanced care planning. This is really important. I equate your advanced care plan here in Nova Scotia. They're called personal directives. In different jurisdictions in Canada, they're called by different names, but basically it's all the same. It's having a care plan for yourself, all right? And it's not just for end of life, but it's also for everyday living. And I mean, we never know. We can walk out of here and somebody get hit by a car. You can, have a stroke. All kinds of things can happen. And if we don't have a care plan in place, then who's going to be able to speak for you as the individual in terms of what kind of care you want or not want, right? Because there are options. And so the other thing that's really important for us to understand is that we have rights as patients. Most of us, or a lot of us I should say, really, the doctor comes to us and says, look, this is what we've discovered, or this is what we think is wrong. This is what I'm recommending for treatment. All right. But we have rights to be able to say, I either want a second opinion because I'm not really comfortable with what you just said to me, or I don't want treatment, right? And or I do want treatment. So we have to know, we have to understand what our rights are. And Dying with Dignity Canada has a tremendous amount of information on its website that you can download or call and ask for a copy of. And one of them is a booklet called Patients' Rights. And it's really very informative. And it really helps us in terms of preparing our plan for advanced care. And the other type, there's palliative and hospice care as well. And we're very fortunate here in Nova Scotia that when I look around the rest of Canada and see what organizations are and information that's available to people other than the website from Dying with Dignity Canada, that there's not a whole lot of information sessions that are being put on across the country. Now, some are more active than others. There's no two ways about it. But we here in Nova Scotia are very fortunate in that our Nova Scotia Department of Health works very collaboratively with Dying with Dignity Canada, and again, in providing information people to make the best informed decisions that they can. And a lot of that information can be obtained from Nova Scotia Health. The history of MAID. I don't know if you've been reading, if you read the newspaper like I do every day. I'm not so sure how long it's going to be a newspaper or be available to us, but there is so much misinformation that's out there about medical assistance in dying. And people use terms like euthanasia. Well, it's not. If you're going to put your pet down, that's euthanasia. All right? Medical assistance in dying is there for people who have diseases that there's no cure for whatsoever, that they're living a life that is not what they want, and so they investigate whether they should proceed with MAID. And it is a very long process. It's not something that I can say today, all right, that I want MAID, but I have to have doctor's recommendations, interviews, the whole 9 yards. So it's not something that can be just done basically because you think that you might like it or that you might need it. And there are some legal considerations that are still being debated at the federal level in terms of Parliament. One of them is a mental illness, because unfortunately right now the committees and the federal government will not or have not declared mental illness as a disease, all right? Which astounds me in this day and age. However, we're still working collaboratively with them, but however, they have put off that decision to change the Criminal Code of Canada. And right now, the federal government is saying we won't even look at it until 2027. So that's another, 3 years, unfortunately. Okay. The other issue, as I mentioned, is an advanced care plan, and I think, Sam, you passed out.
Yeah, I just put them down on the table back
Yeah,
there.
exactly. An advanced care plan, as I mentioned, I equate that to the same thing as having a will. All right, a will, you have a will, you have your physical assets. You decide who's going to get the car, who's going to get the couch, who's going to get the the hutch, the whatever, who's going to get my investments, whatever. So those are your physical assets, all right? But an advanced care plan is for you, the individual, in terms of what you think and what you believe your morals and your values are in terms of your care. And the advanced care plan only comes into effect, all right, if you become incapacitated in any way to be able to make decisions about your care. And so, just because you have same thing with your will, nothing happens in terms of the distribution of your assets until you die. Well, the same thing with the advanced care plan, all right? It doesn't come into play unless you become incapacitated in some way. Preparing the advanced care plan is not an easy task, all right? I've gone through it. It takes a lot of soul searching. It takes a lot of thought in terms of the kind of care that you would like to have or not have. And it also, the same thing in a will, you appoint an executor to look after your estate once you've died. The same thing with the advanced care plan. By having a substitute, what we call a substitute decision maker, that's an individual, all right, who can speak for you based on what you have outlined on your advanced care plan. It could be a family member, but it doesn't have to be. Maybe it's a friend who's known you for the last 60, 70 years, and knows that you really well and would be able to speak on your behalf. Sometimes you have to go outside the family to have a substitute decision maker. But again, it's somebody that will in fact carry out your wishes. If, for instance, we end up in a nursing home, all right, what kind of care would you like to see in a nursing home? We had one woman who was part of the original group and still active to a degree, and she was saying, look, if I end up in a nursing home, all right, I want to ensure that I get my hair done once a week, okay? That I like to get dressed in the morning, all right? I don't want to lay in bed all day, if at all possible, all right? I want to get up, I want to get dressed. I want to look my very, very best. I want to ensure that for a lot of us women, go through menopause, all of a sudden we've got little whiskers that we never had before, I want those plucked. Mm-hmm. Those are the kinds of personal things, and that's why we call it personal, all right? And it's just so important. And I think when you look through that information, one of the things that we also do as a group is that if anybody here is interested, what we can do is have an actual working session on preparing an advanced care plan. We limit it to 10, 12 individuals. All right, we sit around a table and we go through the entire process. All right? And by the end of it, you're not going to probably have a completed care plan, but you're certainly going to have the good, nuts and bolts of it. And so again, I would encourage you to look at having, an advanced care plan if you don't already have one. All right, and it becomes a legal document once you've prepared that. All right, and signed it, it becomes a legal document. So your advanced care plan should be shared with your medical professional individuals, whether it's your doctor or nurse practitioner.
Is that the same as a personal directive?
Yeah, the advanced care plan. The advanced care plan basically is sort of the name that everybody uses, but here in Nova Scotia it's called personal directive. In other provinces, other jurisdictions in Canada, it's called by a different name, but it's the same thing. It's a care plan for you as an individual, all right? And it's so critical, and it's the little things that we don't even think about sometimes, or that we don't talk about. The discussion, right, with your family members about a care plan is not always easy, right? Because most times, your family, your children, whatever, don't want to talk about death. They don't want to know what happens, to you if you end up not being able to speak for yourself. And so it's not always easy starting that discussion. When I went through mine, I spoke to my niece that lives here in Halifax, and I said, I would like you to consider being my substitute decision maker. And I said, I would like you to review what I'm setting out for my care. And she said to me, I have to really think hard about it. All right? And she has, and she, she agreed after looking at it, talking with her husband about it, all right? And so she will be my substitute, decision maker if it comes to the point where I can't speak for myself. And so, as I said, it's not an easy process by any stretch. It really gets you to think about yourself as an individual and what is it that you would like for your care. It's very, very important. The other thing about your advanced care plan is it should be shared, again, as I said, with your doctor and your medical professionals. If at some point in time you're thinking about, MAID as an end-of-life option, I discussed that with my family doctor. And I asked her, point blank, if, all right, that's the avenue that I decide to go and I get approved for MAID, would you be my attending doctor? All right? And she said, no, I cannot do that. It is against my principles as a doctor. I said, that's what I needed to know. But she said, don't worry about it because there are doctors who will, all right, assist at a MAID death. So it's important, again, that you have that discussion with your family doctor. Also have the discussion, you know, with your family members. Last year, there was a documentary produced in collaboration with the Dying with Dignity. And in that documentary, it is the story of 4 Canadians who applied for MAID because of their disease. That, you know, there was no cure, there was no quality of life for them as they perceived it. But it tells the story of their journey and their family members' journey, all right, of going through the process. And it is available on YouTube if you want to watch it. And it is called In My Own Time. And it has to be one of the best documentaries that I have seen in a long, long time. Totally non-judgmental. It was, you know, it's the story of the individuals themselves and their family members. And so if you're interested, it is certainly well worth seeing that on YouTube. Again, In My Own Time is what it's called. The other thing that we've discovered is if you had to call an ambulance, all right, because of a fall or whatever, all right, the EMTs are trained. They're like, you know, they're like our doctors, right, in many instances, and nurses. And with an EMT, all right, their main focus is getting you stabilized to get you to the hospital. Right? If you don't have a small document that's the EMTs can easily locate in your residence, then they are going to try various means, all right, to get you stabilized. If you don't want that, all right, they don't know that. So a lot of the EMTs have been trained to look for, all right, a document either attached to your fridge or in the freezer in a you know, a Ziploc bag, all right. They look for it to see what type of aids that you want or not, all right? So again, it's all part of this, you know, advanced care plan. You don't have to have the whole care plan, you know, in your freezer, but something that says to the EMTs, you know, I don't want this or I do want this. Right? So they have been trained, and we work with them on a fairly regular basis to make sure that all EMTs are trained to look for that kind of a document, all right? And it could just be a fridge magnet, something that says, all right, to an EMT, bang, oh, this is what I want, this is what I don't want. Okay. The next one. All right. It's very interesting when you look at these statistics, and these are fairly recent. 80% of Canadians feel that advanced care planning is important, but less than 1 in 5 have an advanced care plan. Right? 93% of Canadians feel it is important to discuss their future health care wishes with their family, but only 36 did. 80% of Canadians feel it's important to discuss their future health care issues with their doctor, but less than 9% did. Right? So again, it's a little scary when you think about it. Okay, next one, Sam, please. Again, these are things that I've already said in terms of the treatment or non-treatment that you want. State where you want to live and die. All right. Some people want to die at home. All right. Some people will like to go into hospice if that's available. And as I mentioned, the advanced care plan, when it's prepared and signed by you, becomes a legal document. All right. So again, the entire medical profession has to abide by that. All right. And you don't need a lawyer in order for the advanced care plan to be drawn up and or legally binding. Okay, next one, Samantha, please. Again, I covered pretty much the personal and health care, the delegate, substitute decision maker. Again, this is really, really important, your substitute decision maker, because that individual, has to be able to speak for you when you cannot. So again, they have to have a copy of that advanced care plan. Same thing as your doctor has to have a copy of it, or should. All right. One thing about not having an advanced care plan or not appointing a substitute decision maker, this one is really, really important. If you are unable to speak for yourself, all right, there's a hierarchy that the medical profession goes through in terms of who do they contact so they can discuss, all right, what's going on here, or what can we do, what should we do, all right. It's really important if you're separated but not divorced, all right, and or parents, and maybe you're estranged from some of your children, all right, and the individuals in the hierarchy may have different values from yours. So again, it's so important to think about all of these, and if indeed, all right, if they go through the hierarchy and can't find anybody, all right, or anybody that's willing to discuss the issue and say, yes, mom wants this, or no, grandpa doesn't want that, then they'll end up going to a public trustee. So, I mean, that's not always a pleasant journey either. And so, again, very important to make sure that you have a substitute decision maker. Okay, Samantha? Yep. The other important documents, as I mentioned a little earlier, I equate the advanced care plan or personal directive the same thing as your will, right, and your power of attorney. They're all different legal documents, but they're all important. And again, it's the same thing as having your will, right? Or any other document. You review it every 3-4 years, or maybe sooner, whatever, because our health conditions can change, and so it's important to review that advanced care plan. Alrighty, next one, please, my dear. Thank you. Again, the advanced care plan kit, which you have a copy of. So. Anybody who's joining us via Zoom, you can in fact get on the website with Dying with Dignity Canada, and you can download the Advanced Care Plan kit. And there are various sources. As I said, the Nova Scotia Department of Health has a lot of documents on available to you as well. And there's also, the Canadian Hospice Palliative Care Association as well, has a lot of information about end-of-life choices and advanced care planning. Okay, I think that's probably, yep, there we go. One of the things that, and again, I'm still on a learning curve in terms of, the information that's available. and legislation that's before federal government at the moment. One of the things about MAID is, in order to be eligible, even for MAID, or even to think about MAID, is that we have to be a competent individual, all right? And when I think about that, and when I think about something else that's come up in the last number of years from people across Canada, have said, okay, I'm a competent individual, right? I can make my own decisions. But one of the things that we cannot do at this point in time is have what they call an advance request. So in other words, that just astounds me, because in order to make a will, you have to be competent, right? In order to make your advanced care plan, you have to be competent. However, when it comes to an advance request, all right, for MAID or any other options, the federal government they don't seem to want to deal with that issue right now. So there is a lot of lobbying going on by groups across the country, not just Dying with Dignity, but with others, saying to the federal members of parliament, look, if I'm capable and competent to draw up a will, if I'm capable and competent to have an advanced care plan, why can't I while I'm still competent, make an advance request, all right? And it only comes into play, again, if, all right, I can't speak for myself. So just want to keep that in mind, something in terms of some lobbying that's going on. All right. Patient rights, as I mentioned a little while ago. We have the right to have a second opinion, to make sure that your substitute decision maker is recognized as the legal individual who can speak on your behalf if you become incapacitated. And you can refuse or discontinue treatment, right? That's your right. And you have a right to refuse food or drink. Right? Again, those are all things that we may not want to think about necessarily, but are very important as time goes on. Okay. Again, these are treatment levels, and again, these are all things that we can go through, again, with your advanced care plan kit that you have. And as I said, getting together and in a small group and actually sort of working through the bones of an advanced care plan. CPR, one of the things that one of our individuals have said, talking about CPR, we watch TV, we watch medical programs, and we see CPR being given all the time. But what we don't see are the horrendous results of CPR, all right? Because sometimes, they have to break your chest bones, all kinds of things. So again, understanding what goes on with CPR is very, very important. And again, if we have a do not resuscitate, all right, what that actually means, again, that's explained. And you can refuse, all right, as an individual, that you don't want that. That's it, that's no more. Okay. Now, this is very interesting, and this is relatively new. I think it's about not quite 2 years old in terms of the statistics. And these are the causes of death in Nova Scotia that have been recorded. All right, sudden death, almost 4%. Terminal illness, almost 32%. Organ failure, 33%. Frailty, 27%, and other. All right, that's just a little bit of statistics that they've thrown in there. Palliative care, all right. terminal sedation, and medical assistance in dying. Those are your end-of-life options, right, to consider. Okay, next one. Now, this is really, really important to remember, that MAID is legal in Canada, right? And it has been since 2016. There have been some amendments, and if you look at number 3, since 2016, there were over 1,700 referrals for MAID that were requested here in the province of Nova Scotia. And of those, 829 MAID deaths were completed. So again, it's an end-of-life option that more and more people are thinking about, and more people are applying for, because for them, for most of them, again, if you watch that YouTube documentary on it, you know, it details those individuals' journey and why they applied for and were approved for MAID. All right. Okay. Now, again, who's eligible for MAID? Not everybody is. Okay. I mean, it's not. It's in. You have to have health services funded by the government. Well, here in Nova Scotia, we do, of course, as in some other jurisdictions. Be at least 18 years old and mentally competent. Number 3, have a grievous and irremediable medical condition. That is the main, that's the bones and the main reason why MAID was approved by the federal government. Okay. Who cannot access MAID? Individuals under the age of 18, individuals whose sole condition is related to their mental health. And again, you cannot include a request for MAID in your personal directive, okay? All right. And you have to provide written consent before you receive MAID. And again, as I said, it's not an easy process for anybody to go through. And anybody that has, they will tell you the same thing. Because there can't be any undue influences on the individual who's applying for MAID. Right? That's one of the key elements. Okay, Samantha. Again, these are all the things to think about, all right? What if my family disapproves? Religious considerations, very important. Who do I want with me during the procedure? And in terms of MAID, there are 2 procedures. One is administered by a medical professional, and the other one is administered by yourself, okay? So those are 2 options. All right. Now, upcoming legal reviews. These are some of the things, again, that are still being discussed. Severe mental illness, mature minors, and dementia diagnosis. As time goes on and the federal government deals with some of this, well, I don't know what's going to happen if we're going to have a federal election. That's the case. A lot of these things just get put on the back burner until either the government is reelected or a new government comes in. And again, the number of practitioners willing to perform MAID have increased, and 94% of MAID administered by family physician. Here in Halifax, at the hospice, up until about 2 years ago, if someone had applied for and was eligible, all right, to receive MAID, the hospice would not accept them as a patient. in the facility. They hired a new executive director. The board took a good look at its policies and procedures, and their vision and their mission statement. And their mission statement was very, very simple. All right, one-liner. All right, we are here to provide the best comfort care for our patients, plain and simple. However, they weren't following that because they wouldn't allow patients, MAID patients, to go into their facilities. That now has changed. All right? So more and more you see that. And so the hospice here has certainly opened its doors in that regard, and as well as some of the hospices in other areas as well. Some hospitals across the country, again, all right, don't want to deal with administering MAID, so that that individual or those individuals have to find somewhere else to go. Again, this is changing over time, and I'm sure it will. A lot of individuals want to remain in their own homes, right? That number is increasing. This is 2021, so that's about 3